I would get shin splints from the running, even from marching just on pavement and boots, to the point where I would get running waivers because the pain would be so bad. Bruising, visible bruising up and down the shin. So it really put me out of running in the military for a long time. When I first met my patient, Kelly, she was, first of all, a very young patient in my eyes, having a lot of issues with her feet and never really getting the answers she was looking for from the other physicians she had visited with. And I could tell she had done her research. I had gone to a previous doctor who was going to do something a lot more invasive. I was going to be on crutches for months, and I didn't know that it was just basically because of the overpronation and that there was anything you could do about that until Dr. Ledesma told me about HyProCure. The old me was in chronic pain from my toes all the way to my back. My toes would hurt, my arches would cramp, my ankles, my shins, my knees, my lower back would hurt, and to varying degrees depending what I would do. So I would find myself not wanting to go do anything that would cause me to stand in a line for a long time, not doing any physical sports, and if I did, just because out of the love of the sport, I would do it, or if I had to run, I would do it, but then I would suffer for X number of days after until the swelling and the pain would go down. Now I can walk the mall in sandals and not get shin splints. I can definitely run, I can play softball, I can go to the gym, I can do anything. I can wear heels. I don't have to change my shoes just because of the pain. I can stand in lines for a long time without lower back pain. So it's just completely changed everything physical, from walking and standing all the way to, you know, high impact sports. In my eyes, for adults, there is no comparison. And the nice thing about it is, as well as it works for adults, it works just as well, if not better, for kids. You know, the kids, I find myself, with the older implants, I tended to be a little bit more tentative or shy about letting them be on their feet right after surgery. With the HyProCure, unless I'm doing something else on top of that procedure, I'll let them walk pretty much that day and put them into sneakers within a week. And they're back to their relative normal lives in regular shoes, very little recovery issues at all. I always get caught off guard by how much it affects my patients. You know, I expect to hear the stories of it, but actually having them in the office and saying, I can walk, you know, I can do things now, I don't limp, you know, I walk normal, I stand taller, I can run faster. And it's always cool to just see it on their face, you know, not so much the words that they're saying to me, but just you could tell. For me, it's just I can rely and be confident on the procedure and the implant itself for producing those kinds of results. I mean, it can be extremely dramatic in a lot of cases, and you know, for me, that's what the enjoyment I get out of offering that procedure, because I know it's a good procedure. It's an excellent, superior implant compared to the other competitors. And I love seeing that kind of response. I'm an engineer, so you know, I research everything. And I researched this before I did it, because I certainly wasn't going to go through it and not do that. And the testimonials that I read and watched, they were true. Like, everything I'm saying was like what I heard them say, and they were real.